Hello. Good morning, everybody. I can't even tell you how excited I am to be here. This is my fourth year. Oh, I should introduce myself. My name is Robin Swoboda. But if I do anything silly or stupid, my name is Wilma Smith, so just remember that. This is my fourth year, so for some reason they keep asking me back, and I am so appreciative, but I did say to my table mates up here, I kind of miss the days when you know, we could wear our pajamas from the waist down and maybe put on just a smidgen of mascara, because ever since chemo, my hair has grown back in weird, and I don't really have eyelashes. So some women apparently can put on eyelashes very well. Mine usually look like RV. Yeah, thank you. This one went on really well, and this one I glued my eye shut. So I texted Tanisha and I said, it's been a bumpy morning here in Medina County. But anyway, here I am, and we're ready to go, and I've only had one cup of coffee. So the more coffee I drink, the faster it's gonna go. I wanna thank you so much for being here today for the Cuyahoga County Division of Senior and Adult Services 4th Annual Advisory Board meeting, the annual one. I am beyond excited, as I said, to be your host once again. 4 years. And the last 2 in person, and so it's so fun to see all of you, and I feel like it's a reunion from last year, certainly, when I got to see the faces with the bodies, and I won't go any more into that, because probably, anyway. I live with dogs, so it's so fun to see people. I go to church, and they're like, it's not time, get out. Get out. You've worn out your welcome. Which, can I tell a really quick story? So I started going to this new church last summer, and it's a Canaan Free Will Baptist out in Creston, Ohio. If you've ever heard of Creston, Ohio, it's way down south. And it's embarrassing, when you're on TV, because you're in the house of the Lord, right? And people ask for your autograph. And I'm like, I don't feel comfortable with that. But this little man came up and he said, Robin Swoboda, can I have your autograph? And I'm like, oh, okay. And so I wrote, Dear Harry and something. That was on a Wednesday night. On Sunday, the pastor announced that he goes, that corner back there, I've got bad news. That corner back there is going to be a lot more quiet. And he said, the good news is that Harry went home to be with the Lord. And everybody was like, oh, good for Harry, he's up in heaven. And then somebody comes up to me afterward and they said, do you know who Harry is? And I said, I'm sorry, I don't remember who he is. And she said, you signed an autograph for him. And I said, oh, I do remember that. And she said, do you remember what you wrote? And I said, I don't. She said, you wrote, Dear Harry, I'll see you in heaven. I'm like, ooh, I have the gift of prophecy. But nobody has asked me for an autograph since. So anyway, don't anybody, unless you're ready to go home, don't ask me for an autograph. This year, our theme is, who can I borrow a cup of sugar from? Reducing social isolation and loneliness among older adults. Today, we will be exploring how we can come together to tackle these important issues, which have a profound impact on the well-being of so many of our older residents. We're also going to hear from some amazing speakers and dive into how we can strengthen connections and reduce isolation in our community. And I love the fact that it's who can I borrow a cup of sugar from, because a number of years ago, my nose is running. Can you see it? Okay, good. I'm Wilma Smith. No, Wilma she would never have a runny nose at the podium, I can tell you. She was far too elegant. But years ago, have any of you ever done the friendship bread? Oh, did you like it? It's almost like having a pet that gives you nothing in return but, wider hips. And so, but I had this friendship bread, and I was trying to keep it going, and I called a friend of mine because I was out of sugar, and I said, do you have any sugar? And she said, I'm out of town, but you can go over and help yourself. The door's unlocked, because that's what we do down there in Medina County. Nobody locks their doors. Everybody goes in, gets what they need. So I go in her kitchen. I'm looking all around for the sugar. I can't find it. I can't find it in her pantry. She doesn't have any sugar bowls. I need like a cup of sugar. Then I notice on our counter all of her, what do you call those things? What? No, the thing, the flour, the sugar, canisters. Thank you, ding, 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 ding. Canisters. So I see the one that says sugar. So I'm very excited. So I open it up, and I kind of had to scrape a little bit of it out. But I thought, maybe they don't use a lot of sugar. So I took it home, put it in my friendship bread. It went flat. It didn't do anything. So when she came home, she said, did you get that sugar? And I said, I did. I said, it was hard to find, but then I found your canister over on your little sideboard there. And she said, oh. She said, that was my grandmother's canister set. And I said, and that was your grandmother's sugar in there? And she said, mm-hmm. I said, and how long has she been gone? She said, about 46 years. Sugar has a shelf life, people. All right. So, borrow a cup of sugar from somebody who has fresh sugar is what I say. So we are very, very grateful today to our sponsors for making today's event possible. A big thank you to the Cuyahoga County Board of Developmental Disabilities, United Way of Greater Cleveland, the Cleveland Foundation, and the Western Reserve Area Agency on Aging for their generous support. We have a huge, great, fabulous morning ahead, including inspiring remarks from members of of DSAS Advisory Board, a lively panel discussion. And be sure to follow along with the agenda. And if you can scan the QR code on the centerpiece at your table, and you will find bios of all of our speakers and a copy of all the slides presented. So let's begin and dive into this very important conversation. We will open the meeting with Cuyahoga County Chief of Staff Eric Janis, who will share welcoming remarks. Come on up here, Eric.
You're welcome. Good luck.
Oh, thanks. Well, good morning, everybody. My name is Eric Janis. I'm Chief of Staff to Cuyahoga County Executive Chris Ronayne, who unfortunately is out of town today and could not be here. And I'd like to welcome you all to the Division of Senior and Adult Services annual meeting. It's heartening to see your focus on providing opportunities and essential programming to the residents of Cuyahoga County of all ages and abilities, but especially for our seniors. I'd like to take the opportunity this morning to thank Director Petricola, the DSAS staff, and the advisory board for your dedication to our aging population. Congratulations on this successful event and for your volunteering, your expertise, and your insight for DSAS over 30 years. The world's demographics and Ohio's and Cuyahoga County's are shifting to an older population, and locally we want to be prepared for the future. DSAS is leading the way with the Livable Cuyahoga initiative and consistently striving to find better ways to serve our aging community. Through its commitment to serving and providing resources to older adults and adults with disabilities, you at DSAS make a significant impact on our community. As you all well know, connecting older adults with essential services such as home care, meals, and transportation, among others, will help them maintain their independence and their quality of life. In addition, I appreciate how Adult Protective Services ensures that senior rights are advocated for and that they are treated with dignity and respect. I'm going to be able to stick around for a little bit this morning, so I'm excited to hear about the ideas and insights addressing social isolation and loneliness among other adults and the other topic points on your agenda today. Once again, I want to thank you all for the work that you do to keep our seniors healthy and keep them safe and ensure their voices are heard. Have a great morning, and I look forward to the conversation. Thanks.
I'm not just a host, I'm a client, really. I went to the doctor last time. She goes, "Do you have one of those grab bars in your shower?" I'm like, "How old do you think I am?" She goes, "Really, everybody should have one." And I'm like, "Yeah, I know. I get it. All right, it is my pleasure now, moving along, to introduce Natasha Petricola, the Director for the Division of Senior and Adult Services, as we like to call DSAS. She puts the sassy in DSAS. That was just an ad lib. Natasha did not write that. She will share the incredible work her team alongside the advisory board has been doing to make a real difference in the lives of older adults and adults with disabilities in our community. DSAS plays a crucial role in supporting people to age gracefully and safely in place, offering vital programs and services that truly enhance the well-being of our aging population. Natasha, we are very excited to hear from you. Come on up. With the sass.
So good morning, everyone. We've done a lot of thanking this morning, but again, I just want to reiterate, I want to thank our sponsors for making this possible. You know, if you've been in meetings with me, I'm always complaining about money, so earmuffs, Eric. But, you know, without all of you in this room, we can't partner and we can't collaboratively work. And I really feel it's the community's effort that really provides the services to ensure that from our most to our least are always taken care of. You know, there's a lot of focus on children, there's a lot of focus on younger adults and employment, but what we really have to keep in mind that there is also a need for this focus on older adults as they age, and just with dignity, and for us to really keep them top of mind, because I think sometimes it is a population that's forgotten. And so our mission here, as well as with many of you in the room, is to always put that at the forefront. So at DSAS, we've been extremely busy. We know that our numbers every year, since 2020 especially, have continued to just skyrocket. Last year, we saw a record number of calls received through our Connection Center. Keep in mind, the Connection Center is open pretty much Monday through Friday, 8:30 to 4:30. There are 10 social service workers who sit on that hotline, and there are 2 supervisors responsible for it. We received over 28,000 calls last year for people searching for some type of assistance, support, or programming. Obviously, not all those clients were opened at DSAS, but the majority of those that did come through went through programs such as Adult Protective Services, who also had a record year. Since the inception of the way we set up our agency with a freestanding intake department and then the units that they're established, we saw over 2,800 unduplicated APS cases come through last year. These aren't multiple calls. These are one calls where somebody is reporting either abuse, neglect, self-neglect, or exploitation against an older adult. We do, by the grace of God, have a robust APS program. We have 30 social service staff, which is very unusual. We're the largest in the state of Ohio. But looking forward, just like Eric had mentioned, the demographic in Cuyahoga County is at a point now that we are older than we are younger. There are more people turning the age of 60 than there are people 18 and under. So we have a very short window to try and really figure out how we have to bolster services and create a deeper and better safety net for all those that live within our communities. 30% of our population by 2030 will be 60 or older. And yes, this is a trend that we see across the nation. America's an aging demographic. Now, there's some beauty to that as well. It means one thing: we're living longer, right? We have more time on this earth to enjoy life, but it also means that that comes with a cost, that there's housing issues and housing stock issues for older adults. There are issues with food insecurity that we talk about many a times. We have a board that is deeply committed to the mission of everything DSAS does. And I want to take just a second for all the board members who are here with us today to please stand up, just so that we can recognize you and your efforts. I truly feel that the men and women who just stood up are definitely in this fight with us. They are definitely people who I consider partners, friends, colleagues, allies, that when we need something, they're a phone call away. So we really, truly appreciate the time and effort that you dedicate to our board to try and make this county a better place for older individuals to live. In addition to our APS program, we also have an Options for Independent Living program. That program provides a couple of core services such as home-delivered meals, transportation, personal care, homemaking, a life alert. They do a laundry service because we didn't have enough family service aides to get into the homes to help seniors with laundry. And most of the seniors we serve live in older homes. And when you think of a laundry room, they're not fancy first-floor laundry rooms. They have to go down a steep set of stairs oftentimes that create a fall risk for them. We also have our home support division, where we have family service aides who go into the home and they provide personal care and homemaking services, in addition to 10 nurses who also manage those cases, do biometric screenings, and check up on those clients on a monthly basis. Because of the pandemic, we decided that we needed a behavioral health unit. A lot of people think that when you turn a certain age, like this magic age of 60, that certain things go away, right? Well, if you've had mental illness as a younger adult, you more than likely have mental illness as an older adult. And the propensity of somebody with mental illness as a younger person increases your risk of developing some type of cognitive disorder as you age, such as Alzheimer's, some type of dementia. So that's why it was so important to us to kind of refocus and also find a way to work closely with the geriatricians throughout Cuyahoga County. We also do geriatric assessments, teleassessments that have proven to really utilize resources better, that we don't clog up our probate court system. If we can do that in real time and send out one of our behavioral health staff, either one of the 2 social workers that are currently staffed there or our nurse, we can get this done efficiently and kind of hopefully determine what is going on with that senior before something worse happens. So that brings us to today. The reason we thought about this topic is because we know that numbers have increased, especially since the pandemic, but maybe it never did. Maybe we just took more notice of things that had happened because of the pandemic. There are studies that were conducted in 2023 by the National Institute of Health that found that when they polled seniors ages 50 through 80, that 37% of those people reported that they felt socially isolated. In addition to that, another 34% felt that they were lonely. So when you look at that, and those are just people that were randomly polled, it makes you wonder how many people were still missing in that equation. So when we were talking about an idea for this year's topic, we fell upon this one because we think that this is something that doesn't get enough attention, the well-being and the mental health of people. People are stressed out. And the only way to deal with that is to kind of look at the different stressors and then to provide them some support. So when I was reading some research, I found this very interesting article by Stephen Cole. He's a doctor with UCLA, and he works with the National Institute of Aging, and he does a lot of research in this arena. And he wrote this down, and I took this from his work. It says, loneliness acts as a fertilizer for other diseases. The biology of loneliness can accelerate the buildup of plaque in arteries, help cancer cells grow and spread, and promote inflammation in the brain, which leads to Alzheimer's disease. Loneliness promotes several different types of wear and tear on the body. So as you can see, we talk a lot about just the regular things that happen with aging, but sometimes we don't think about the emotional impact that aging does have on people we even care about. So hopefully today, I hope through this program that you start thinking a little bit differently about what aging truly means. Also, about 2022, we started this initiative called Livable Cuyahoga. We're an age-friendly county, and a lot of the things that we're doing right now at our agency is really tying into this, looking at the social determinants of health, not just from one angle, but from every angle to ensure that we're not missing something, because they are so interconnected. If you have nowhere to live and you don't have food to eat and you can't afford your medication, what ultimately happens? And the cost to put somebody in a nursing home is exorbitant. Right? It's much easier that if we can wrap services around an older adult, that they can hopefully sustain as long as possible without having to go into an assisted living or a long-term care facility. And trust you me, it's not easy to get into some of these facilities. They are just as taxed as the rest of us with resources and services. It's very difficult to find home health aides and family service aides in today's arena. People just aren't attracted to these kind of professions any longer. So there's a lot of transition between them. So as you sit here today, please take a lot of stock in what maybe we can look at as a community to bolster just drawing attention to this cause. Thank you.
Well, that was eye-opening. You know, for those of you under the age of 60, how many people are under the age of 60 here? Get out. No. Under 65. Over 65. Yes. I'll meet you at Drug Mart on Senior Wednesday. Which I went one time accidentally, and there was some woman yelling, "Seniors, seniors!" And I'm like, I don't think that's what they mean. But that's really, that's a very eye-opening, what you said, the quote about the man and what being a senior and being in isolation can do. So, every year I get educated. when I come here. All right, that was very, very, very good, and thank goodness for your team and all the work you're doing. It's very, very important that we hear the statistics and know that you and your great team are addressing them. All right, now, the Senior and Adult Services Advisory Board is made up of 24 dedicated professionals, I believe who we saw stand up, each contributing their expertise and passion to support the aging and disability community. This group of leaders comes from a variety of backgrounds, bringing years of experience in advocating for older adults and individuals with disabilities. They are essential in shaping aging services in Cuyahoga County and beyond, pushing for important legislation, securing funding, and developing programs that enhance the quality of life for all of us, really. The board meets every other month to collaborate on shared goals, and they are also responsible for hosting this annual meeting to share the important work that they are doing with all of you. Now, let us hear from a few members of the DSAS Advisory Board, beginning with the board chair, Janet Keeler. Come on up, Janet. Oh, thank you. Right away, because if I trip, you're covering me.
Good morning, everybody. Gosh, that's a big picture over there. I'm glad I'm standing looking this way. Good morning to everybody, and thank you all for braving the cold, the traffic, the flu, the weather, and everything to get here today for our 4th annual DSAS Advisory Board meeting. And thank you, Robin, for being our MC again for the 4th time. We always appreciate your enthusiastic support of the work that DSAS does and that the board does as well. These annual meetings are an opportunity to share some of the highlights from a year's worth of advisory board work. They're an opportunity to introduce the board to others in the disability and aging space and to share current and relevant research and information critical to the work that we all share in doing. As Robin mentioned, we have 24 board members from all walks of the aging and disability space. As the current advisory board chair, I am infinitely grateful for their deep industry expertise, their ability to think strategically, our robust network, and as well as their commitment to actively listen and offer feedback. This board is active and engaged and works to stay informed in their work to help support DSAS's success. I'd like to highlight some advisory board happenings from 2024. First, in 2024, we recently welcomed 4 new advisory board members. Victoria Bowden from Metro Health, Ben Goodwin from the Adams Board, Robin Kaltenbeck from AARP, and Alyssa Peters, who you'll hear from later, from the VA. In addition to our 4 new board members, we also have 4 people returning to serve a second 3-year term on the DSAS Advisory Board. Cheryl Broaddus from Walsh University, Denisha Green from the Cleveland Rape Crisis Center, Chris Hall from Western Reserve Area Agency on Aging, and Jennifer Kahns from the United Way. These returning board members are such a wonderful testament to the commitment to the important work that this board and DSAS does. Last year, the board worked to strengthen our advisory board mentoring program. It's important to us to not only recruit recognized and seasoned professionals to the advisory board, but also to develop and support them in their board positions. In 2025, we'll start this mentoring program with our newest members, Vicki, Ben, Robin, and Alyssa, as we've already identified existing and eager mentors for them. Last year, we began discussions to develop a board portal. There is a vast amount of information, as you can guess, generated for and in board meetings, subcommittee meetings as well, and reference documents and important information about DSAS that would be beneficial for board members to have in one place right at the tip of their fingers. Creating a portal as a one-stop shop to access all of this will facilitate optimal communication and help the advisory board work more effectively and efficiently to support the important work of DSAS. The board continues its strong involvement in the Age-Friendly Livable Cuyahoga Initiative, now in its 3rd year. As Natasha mentioned, the Livable Community Initiative is a comprehensive 5-year process aimed at enhancing the quality of life for older adults and promoting healthy aging across Cuyahoga County. This process is informed by a Livable Cuyahoga Advisory Council, which is comprised of community leaders, advocates, and many of our own advisory board members. Together, they are actively working to ensure that Cuyahoga County becomes a more inclusive and supportive community for all residents of all ages. Along with issues like transportation, housing, and health services, as you can imagine, another important area recognized as critical in Livable Cuyahoga to successful, healthy aging is social participation and inclusion. So today, through the expert lenses of our speakers and our panelists, the existing problem of social isolation and innovative solutions will be discussed. Finally, at every type of meeting that we have every year, we carve out some time for a few advisory board members to introduce themselves and talk a little bit about what they do and their work with DSAS. Today, you are so fortunate to hear from two people who live and breathe in the aging and disability space. So on that note, I'd like to call up Chris Hall, Chief Operating Officer at the Western Reserve Area Agency on Aging.
I thought I was going to be up here with other people. Anyways, I feel like such a millennial having my speech on my phone till such time as I have to put my glasses on to read it. So for those of you who don't know me, I'm an accountant by trade. And as you probably know, us introverted numbers guys love the public spotlight and to be up here. So be prepared to be entertained for the next 3 minutes. Anyways, I was a bit anxious about being up here, and then I realized that I was going to be following Robin. I've seen Robin host other events, so I reread my first attempt at this presentation or speech, and I realized that even in 3 minutes, I'd probably have all you insomniacs fall asleep. Anyway, so as I laid awake at night, last night, and it started to snow, I was instantly transformed into that 12-year-old who did not practice or study enough for his test and hope for a snow day. But anyway, we're here. So, why are we here? Well, I don't have to tell any of you, and we've already heard about it. You know that social isolation is not new, that it has detrimental health effects, and the studies have been going on for many, many years. But what happened during the pandemic was that it really shined a light on it, because all of a sudden, all of us were socially isolated. And what we do? We started drinking more, exercising less, and of course, making sourdough bread. But once the quarantine was lifted, we immediately got out and started socializing again at our clubs, churches, restaurants, and bars. And that sourdough bread starter laid dormant in our refrigerators. And Robin, you ruined it with the friendship bread, but but we all went out to the Olive Garden and started eating never-ending breadsticks again. But for our consumers, many of that is not an option. Either they're unable to get out, or there's barriers they have to overcome to make that an option. So what am I here to talk about? Well, during the pandemic, we brought back an oldie but a goodie at Western Reserve, a high-tech telephone reassurance program where we reached out to over 300 adults once a week to check on their needs and well-being. Now, for those of you who know Doug, our CEO, and Fatima, our community outreach person, bringing back this program was like finding a high school sweetheart that you had lost touch with, and then at your 40th reunion, you reconnected and realized you had the same feelings. So we reached out to the research arm of BRI because we wanted to figure out how to modernize this and make it last beyond the pandemic. And we started working on a pilot with David Bass and his team. And in a random pilot study that we did, utilizing BRI's care consultation tool, which is a more formalized interaction for the telephone calls, we found very promising results. While the people receiving the BRI care consultation did not show significant differences when they took the UCLA loneliness assessment, because both groups, the ones that did and did not receive this intervention, were receiving some type of intervention. However, the care consultation group did have a couple of unique findings. They expressed wanting more help for their identified problems. They also received a lot more referrals for the supports, and they started or continued to use the home and community-based services at a much higher rate. The results were significant enough that we were encouraged to submit a letter of intent to the Person-Centered Outcome Research Institute. And after reviewing it, PCORI invited us to submit a full grant proposal, which would allow us to follow 750 individuals over the next 4 years and try to make this telephone reinsurance program an evidence-based program. BRI is leading the project, and the AAAs, 3 AAAs in Northeastern Ohio, including Western Reserve, Direction Home Akron, and Direction Home Youngstown, would actually be doing the work. So hopefully we get the funding, but as we all know, funding streams are all up in the air at this moment in time. But if we do, hopefully we'll be able to follow these folks for 4 years, and I'll be back here then to tell you the results. Thank you. And now I'd like to introduce fellow board member Beth Sipple.
Thanks, Chris, and good morning, everyone. I'm going to talk a little bit this morning about our Senior Companion Program at Benjamin Rose, where we rethink aging. So our program provides companionship to older adults throughout Cuyahoga County. And through about 15 to 40 hours of service per week, the volunteer and client both benefit from this peer relationship. As you see on our slide, in 2024, 45 volunteers provided 27,315 hours of service to 241 clients. It's just tremendous. We've been focusing on decreasing social isolation, and that is the focus of this program. And our program has a direct impact on this, and we provide companionship. Our volunteers are 55 and older, and they serve individuals in group settings, and they serve them in one-to-one settings, like senior housing buildings, and also we provide help with group settings, so senior centers and McGregor Pace sites. And we provide these services to clients who have cognitive deficits and functional impairments. And our program began at Benjamin Rose in 1981, and that was through a grant that empowered older Americans through volunteerism. We are an AmeriCorps Seniors program, and our sister programs are Foster Grandparent and RSVP. And nationally, these 3 AmeriCorps Senior programs have tracked the impact on health and wellness and community engagement. 84% of volunteers report stable or improved health after 1 year of service. And 88% of the volunteers who felt a lack of companionship reported fewer feelings of isolation after becoming an AmeriCorps senior volunteer. So you can hear the benefits of even volunteering. Our staff at Benjamin Rose recruit volunteers and the locations for the volunteers to serve, called stations. And some of our one-to-one placements, again, are in senior housing buildings, assisted living facilities. Our group stations include the senior centers, McGregor Pace sites. Under AmeriCorps senior guidelines, in order to become a location for the volunteers to serve out of, The organization must be a government entity, such as a municipality or a nonprofit organization or a healthcare proprietary agency, but not a skilled nursing home. Benjamin Rose staff train the volunteers. We conduct background checks, and we provide 20 hours of classroom training and at least 2 days of shadowing an existing volunteer. So we help the volunteer look at what their strengths are and their preferences to where they would like to volunteer out of and serve. We provide monthly training to all the volunteers. They come in 1 day a month. During our monthly in-service, we provide training on topics that benefit the volunteers and their clients. So we provide information about community resources, information about topics like dementia, mental health issues, chronic illnesses, and then topics the volunteers suggest. Sometimes they plan their own presentations, and we just celebrated Black History Month. The volunteers planned and ran that program. During the latter half of the pandemic, we used the Lubin Social Isolation Scale to measure the impact of isolation on the volunteers. And as the volunteers returned to in-person service, we noticed the decrease in isolation scores. And our Center for Research and Education at Benjamin Rose conducts annual volunteer and client experience surveys, and they ask for feedback about our program. And that's where we hear a lot about how much the clients value the relationship they've established with their volunteers, because they're with these folks 15 to 40 hours a week. Meaning, purpose, and community are found through service. This is a valued combination and our proven recipe for reducing isolation and loneliness. Thank you.
Thank you all. And Chris, I think you and I have an idea for a comedy tour here. My kids are very funny. My oldest, he's hilarious. And I said, you know, Matt, we could do a stand-up comedy routine together. I know people at Hilarities. And he said, Mom, he said, neither one of us cuss. He said, so we couldn't get jobs anywhere except, what did he say, churches and bar mitzvahs. And I said, well, we could close our ears and just have them rattle off cuss words, you know, from the announcer booths for the people who needed to hear that. And then my youngest said, hey, I want to get in on this. And then I said, oh, we can be the Mother Smothers Brothers show. If you get that, that's very funny. Anyway, Chris, you were hilarious. And thank you, Janet and Beth. Thank all of you. All right. We're going to shift our focus today to the powerful theme, who can I borrow a cup of sugar from? This topic is critical as we explore how to foster meaningful connections and combat isolation in our community. We're excited to welcome our keynote speaker, Emily Campbell, the president and CEO of the Center for Community Relations. Founded as one of the earliest federated charities in the United States, the center now serves as a nonprofit, nonpartisan think tank dedicated to advancing health and human services. Emily has worked with numerous nonprofits, foundations, and government agencies, offering expert data analysis and policy support to guide decisions that improve lives. Her influential work on poverty has been featured in media outlets all across Ohio. She has been featured in interviews by leading media organizations, not limited to, but including The Economist, The New York Times, ESPN.com, MSNBC, and NPR. We are very fortunate to hear from her today on such a vital issue. Please give a warm welcome to Emily.
Thank you for that kind introduction. Good morning, everybody. I am pleased to be here with you all and in person because there is no way to have the value of the quick conversations that happen when we're together, the informal connections that we make when we are together in person does not happen when we are all on the screen. So thank you so much for being here today, and I'm delighted to see so many familiar faces in the room and hear about the great work that folks are doing across the community. All right, who can we borrow a cup of sugar from? I love this title because I like metaphors, but this isn't a metaphor. This is a real thing. And if you think for a moment about who would you borrow your cup of sugar from, or I think more critical today, who would you ask to lend you an egg? I think we can all think of people that we might call if we're going through something or need someone to talk to. But there's also something important about informal, physical, face-to-face connections, as the research shows. So today I'll be talking a little bit about some of the data related to social isolation and loneliness among older adults and really among people of all ages. You heard a wonderful tee-up from Natasha and others about the importance of this issue. But let me tell you a little bit, for those of you who may not be familiar, about the Center for Community Solutions before I kind of go on. So Community Solutions, founded in 1913, we're well over a century old, have always been here in Cleveland and always worked at the intersection of health, social, and economic conditions. Today, I mean, I hesitate to say this, but today our work is more important than ever because of the climate in which we are operating, because Community Solutions both analyzes and advocates, and we convene and collaborate. And with all the things that are happening in Washington, D.C. at the federal level, with the state budget moving, with Health and Human Service changes having to happen every day, our work has never been important. And it's a heck of a time to lead an organization that exists to protect the social services safety net and works on systemic change through public policy. So happy to talk a little bit more about some of our other work at another time, but today we're going to focus on social isolation. So who would you call? Who would you reach out to? Whose door would you be comfortable knocking on? That's an even higher bar if you needed to borrow one of those very valuable eggs these days. If right now it was late, if stores were closed, if you needed something right away, if you couldn't get your car out of the garage because it was snowed in, who would you turn to and where would you go? Those kind of social connections are vitally important for the health not only of the community, but also of us all as individuals and the well-being. Connection is vitally important, and it may just be the secret sauce, or at least one of its ingredients to overall well-being. This is what the data is showing. So the opposite of some of the negative things that being isolated and lonely can cause are the positive things that happen when we become more connected, when we find ourselves feeling less lonely. Before the pandemic, during the pandemic, and afterwards, Community Solutions noticed a pattern. We're feeling it individually, ourselves, and we're seeing it in the data. More and more people reporting that they are feeling lonely and that they are experiencing social isolation. And there is a difference between those two things, as I'll talk about in a minute. But this isn't news to people that have been working in the older adult space, that have been working in senior services. Social isolation, the importance of connectedness, combating loneliness has been something that you all have worked on for decades and are really the leaders in this space and have a lot to teach people that may focus on other ages. So I love this section from a piece that came out in Yes Magazine in 2019, pre-pandemic, saying borrow the sugar and small works. And it's several pages long. I would definitely encourage you to take a look at it. And I'm actually going to read it because I think it's worthwhile to think about. We don't borrow sugar as much as we used to. This is not just because it's easier than ever to run to the 24-hour corner store. It's because our social fabric has frayed. This isn't to say that pockets of sugar sharers don't exist, but most of us avoid asking. When was the last time you scurried over to a neighbor's for an emergency egg? Even though it's easier and cheaper than ever to find what we need without borrowing, borrow we must. It's a habit that builds community, fosters connection, counteracts loneliness, and incidentally saves planetary resources. Connections, these loose, informal connections, make for happy communities and less lonely adults. It was 25 years ago, in the year 2000, that the book Bowling Alone was published, showing the data about how Americans are joining less, they're connected less, and the result is loneliness and social isolation. A poll conducted in 1972 showed that about 45% of Americans felt they could reliably trust other Americans. That proportion had shrunk to 30% in 2016, and I don't want to know what it is today. I bet it's even lower. In 1960, single-person households accounted for only 13% of U.S. households. In 2022, that number had more than doubled, so 29% of all households are single-person households, and it is much higher for older adults. It's the highest for adults on both ends of the age spectrum, younger adults and older adults, sort of seeing the same things. There might be intergenerational opportunities there. In 2018, only 16% of Americans reported that they felt very attached to their local community. Only 16%. Research shows, however, that people can improve their own well-being with small talk. There was a study that was conducted in Chicago among commuters, and they randomly assigned commuters participating in the study to make small talk with people on the train, on the bus, people they didn't know, as they were commuting. Even if the participant didn't want to, those who made the small talk reported being much happier when they did. So if we have within our power the ability to make ourselves happier by just talking to someone, that's something that we can all do. And there are benefits for both the person who reaches out as well as the person who receives the connection. This grabbed headlines a couple years ago. And here is the headline. Loneliness poses health risks as deadly as smoking, the U.S. Surgeon General says. This headline came from this report, Our Epidemic of Loneliness and Isolation. It was published in 2023 from the U.S. Surgeon General's Advisory on the Healing Effects of Social Connection and Community. And here you see the chart pulled from that report that this sort of headline was pulled from, finding that lacking social connection increased mortality by more than smoking up to 15 cigarettes daily because of all those biophysical and other issues that Natasha mentioned. More than drinking 6 alcoholic drinks daily, more than physical inactivity, more than obesity, and more than air pollution. This is a very robust, hefty report with so much great information. It found that from data across 148 studies, with an average of 7.5 years of follow-up, so many longitudinal studies. These studies suggest that social connection increases the odds of survival by 50%. 50%! Serious impacts and something that we can all do something about and is a lot easier than quitting smoking or stopping drinking or doing more physical activity. A synthesis of data across 16 independent longitudinal studies shows that poor relationships, including social isolation, poor social support, and loneliness, were associated with a 29% increase in the risk of heart disease and a 32% increase in the risk of stroke. And chronic loneliness and social isolation can increase the risk of developing dementia by approximately 50% in older adults. We're seeing similar information when the Center for Community Solutions conducts research with groups here locally as well. This was pulled from a few different reports and analyses that Community Solutions did, including the Livable Cuyahoga report. And what we found is that more than a third of older adults and 60% of people with disabilities experienced measures of loneliness. These are people within our own community. Those measures of loneliness include lacking companionship, feeling alone, feeling left out, feeling that no one knows you, and that the people around you, there are people around you, but not with you. This is using the revised UCLA loneliness scale. So we get a better understanding of the strengths of connections that people have to their communities and the loneliness and isolation that may result when those connections are weak. This data relates to older adults and people with disabilities and chronic conditions to answer these questions, feeling the frequency of connection. And this shows the Cuyahoga County residents who answered they sometimes or always experience some of these measures of loneliness. In data for other age groups or other groups of people, we also see some stark racial disparities. In the National Survey of Children's Health for Ohio parents, during the past 12 months, they were asked, during the past 12 months, was there someone you can turn to for day-to-day emotional support with parenting or raising children? In Ohio, 10% of white non-Hispanic parents said no. 10%, nope, don't have someone I can turn to. It increases to 23% for Hispanic parents and 29% for Black non-Hispanic parents. And so we can see very clear racial disparities relating to some of these issues, to social connection, to social cohesion, to some of these support systems that people need. And when we looked at data for women of all ages for a report for the Cuyahoga County Commission on Women's Health Commission, we noticed a pattern that surprised us. So what we expected to see and what we saw in many conditions relating to health and well-being for women in Cuyahoga County is that things got better during your working age, and then got worse for older adults on a number of measures. But this is one that bucked the trend. And you can see very clearly there that as age increases, the percent of women who experience loneliness in Cuyahoga County seems to be going down. What's going on here? There are some things that we think are contributing to seeing this data, and particularly striking is that people over the age of 75 have the lowest percentage, are 3 to 3.5 times less likely in our community to report experiencing loneliness than young adults who are ages 19 to 30. That's a big difference. What is going right for older adults? One of the things that we think is going right for older adults is the work that all of you do. The work that the Department for Senior and Adult Services do, the long-term focus on the importance of doing things that improve social connectedness, that combat social isolation, and that help people feel less lonely. We suspect that women who remain in the community at older ages also prioritize their social connection. They recognize the importance of remaining connected, and it is important enough with all the other pressures that we're facing to make sure that they get it, to do what they can to get out of the house, to remain connected to their friends and family, to find those opportunities to remain connected. There are many, many efforts in our community focused on reducing older adults' loneliness. I remember as the pandemic was starting to hit things and things were closing, the first thing that was discussed as senior centers needed to close for everyone's health and safety was how do we keep people connected? How can we do this? It was the first thought. There is no other part of the health and human service sector where that connection was the very first thought. And because of that, we see that loneliness and social isolation for older adults has not gotten worse at the same rate as for other ages. It's gotten worse for everyone, but older adults are holding more steady. We talk about it all the time. Even with 41% of older women in our community living alone, people are living alone, but they are remaining connected. And there's an important difference between being lonely and feeling alone. And one other disparity that I want to highlight relates to income. Lower income women across ages are more prone to loneliness than their higher income peers. 40% of those with incomes at or below 100% of the federal poverty level feel lonely, while just 15% of women with incomes at 400% of federal poverty report being lonely. So the difference between 40% of the women living in poverty, 15% of women who are above 400% of the federal poverty level. The distinction between loneliness and social isolation is an important one, and these definitions come right from that Surgeon General's report, taken directly from there. Loneliness is subjective. It's how you feel. A subjective, distressing experience that results from perceived isolation or inadequate meaningful connections, where inadequate, in this case, refers to the discrepancy or unmet need between an individual's preferred and actual experience. We all have different levels of the level of connection that we prefer. Loneliness means you're not getting what you want. You're not getting enough and you feel it. Social isolation, on the other hand, is more measurable. It is objective. It objectively means having fewer social relationships, social roles, group memberships, and infrequent social interactions. So we have the way you feel, and we have an objective way that you are connected. And here's sort of an illustration of what it may look like. Again, you see loneliness, how you feel. The person in this picture is surrounded by people but still feeling alone. Social isolation is how you are connected, and it's not an accident that we chose to show somebody who has a mobility impairment, is sitting in a wheelchair, because the data clearly shows, and our local data, as you saw, show that people who are living with disabilities, especially those who have a physical impairment, face even greater challenges being able to be in their community, to have some of those objective measures of social relationships, social roles. It's harder to be in groups. It's harder to get out and get around. A quarter of older adults ages 65 and over report social isolation, and a third of adults 45 and older report being lonely. So again, we see that loneliness is more prevalent than social isolation. We hear that over and over and over again. The feeling of loneliness is more prevalent than people who are objectively socially isolated. And this data comes from Summit County, from our neighbors from Summit County and Akron, but we see similar data for communities across the community. Because one of the most effective ways to protect against social isolation and loneliness is through connections to both individuals and community. So it's not only who are you going to borrow the sugar from, it's also what are you involved with and where do you feel like you belong. And this is what older adults in Summit County rely on for their social interactions to remain connected to their community. 45% rely on faith-based groups, 38% rely on libraries, 78% rely on friends and family, 28% rely on social media, that number is increasing, and 19% said that they rely on senior centers. That's almost 1 in 5. 1 in 5 older adults in Summit County saying that they rely on senior centers for their social interactions and to remain connected. These things aren't mutually exclusive either. You can, of course, have more than one. But friends and family are a very important component of this. So there's a structural component as well and an individual component. And when we think about the opposite of social isolation, it's social connection and social support. This is where we want to be. We want to move from here to here. Social connectedness is the degree to which any individual or population might fall along the continuum of achieving their social connectedness needs. And social connection is a continuum of the size and diversity of one's social network and roles, the functions that these relationships serve, and their positive or negative qualities. And social support is very important here, the perceived or actual availability of informational, tangible, and emotional resources from others, which is commonly known as one's social network. So those are the official definitions, but I think we all know what it feels like when we are connected, when we reach out. And I'm looking forward very much to hearing the panel because we're going to hear about what local groups and organizations are doing, the specific things that they're doing that are working to build social connection and build social support to combat isolation and loneliness. And what I would encourage you to do, and I think we need it more than ever because these are challenging times for those of us working in these spaces, is to be sure to reach out. We have something here that is so simple to do, that costs you nothing, that has been shown by research to improve an individual's well-being, all individuals' well-being, both the person who's doing it and the person who receives it. And so what I would encourage you to do, I mean, you don't have to go so far as to borrow a cup of sugar. It's okay. But I would encourage you to make a little small talk today. Make a little small talk every day. And if you're feeling particularly weighed down by anything in your life, one of the easiest things you can do is to talk to somebody, even if they are a stranger. So with that, I'm happy to take some questions, and again, look forward to hearing the panel in just a few moments. And we have two folks who are at the mic for questions. You can ask me anything, too. You don't have to just ask about social isolation.
Good morning.
Hi.
Did you all break the social isolation down also into diverse groups, looking at race as a factor?
Yeah, so we have some of that data. There's some places where we have data where it is broken down by race. There's others where we don't. The secondary data does show that there are racial disparities here. There's racial disparities in almost everything that we look at. And so definitely seeing that often people of color are experiencing social isolation at greater rates than other people, especially at younger ages. The disparity starts to be a little smaller when we get to older adults. But yeah, great question. Thank you.
Hi.
Oh,
Sorry. Thank you. I'm really wondering about this intergenerational piece.
yeah.
You mentioned that there was increases in both the younger adult population and the older adult population in this loneliness epidemic. Are we seeing any movement in either of those numbers and coming together, increases in programs that address that kind of thing?
Oh, that's a wonderful question for our panel in a few minutes that can talk about some of those things. When we think about intergenerational programming, we often think about kids and older adults, like the big generational gaps there. And there is an awful lot of evidence that intergenerational programming is beneficial to both groups that are involved, right? And so what I would suggest is that in addition to that, also thinking about how we can have intergenerational interactions between adults of different generations, especially as we're living longer. We have a lot of different generations, even still in the workplace. And I think it's so funny that, some of the popular leisure activities among younger people are what we have sometimes associated with older adults. I'm thinking about things like canning, like sourdough bread, like quilting, some of those things where we're learning those skills and doing it together. And the best place to see intergenerational connections happening among adults is at libraries. That's where it happens. They're open to all ages. People come, they opt in to what they want to do, and they come and participate. And I live in Cleveland Heights, and the Cleveland Heights University Heights Library did a puzzle competition, a jigsaw puzzle competition, and I went. My team won 3rd place. Yes. We had 3 generations of Campbells involved in our competition. My mother-in-law, my daughter, and I, and my husband was there too, but the women really carried the weight. And looking around that room, you could really see it. You could see it and you could feel it. And you could feel the universality of a shared connection. And so that's where it happens, is most often at libraries. Most often in time, I don't think that the library set out to create intergenerational opportunities for jigsaw puzzle, but that's what happens when we get together. Mm-hmm.
Hello.
Hi.
Hi. I'm new. This is my first time here, and I like
Welcome.
to thank
We're happy to have you.
Thank you. And I like to thank Ms. Rucker, who invited me. But I'm talking about who I am, but I retired from CMHI. I just retired December 31st.
Congratulations.
I'm at 64, going on at 65, in between. But I opened up an adult day center, and I'm located on Lakeshore, right across where Dave's used to be. The grocery stores are gone. There's 925 seniors that I've surveyed over there who isolated, who have nothing to do. So I opened up this adult day center where we're going on trips and and we're doing the puzzles, and we're doing a lot of different activities. Ms. Wanda got my computer class going on, you know, where they're coming in. They're so excited to get out the house to do different things. And I'm funded right now through Medicaid because by low income, there's a lot of low income over there.
Yep.
So I want to get more involved. So I want to know, where do I start to introduce myself? Well, Denise was the first one. She stopped in and saw us and said, wow, you've been here how long? So I want to know, how can I get my 925 seniors involved, and also not even just doing the activities, but a survey so I can see the positive outcome. And not just you saying you're coming, but be there.
Right.
You know, because I lived it with my parents. When they retired, I lost my dad, but my mom is still living with me, who's 86. The caregivers
Yeah.
is a very important part too, because we didn't know, I didn't know how to take care of my mother, or I didn't know I was gonna lose my Superman, my dad. That hurt me with the grieving part. Seeing my mom go through the cancer, you know, things like that. You don't wanna wait until we're sick
That's
to
right.
know how to get the wheelchair. So I see a lot of the people in that community, first of all, no food. The food bank and the Hungry Network have come and they've been phenomenal, like Ms. Wanda, to help me. So I need to know, where do I start?
Yeah.
Or how, you know, I'm gonna reach out to Ms. Denise and maybe she'll send me an email so you can get in there and help us. You know, Cleveland Heights I love, I'm Warrensville, but we talking about the seniors who do not
Yes.
know how to get started.
So you're in the right room to get connected.
And my name of my organization is Silver Connections. okay?
Silver Connections,
Silver.
I'm seeing a lot of. I'm sure that afterwards there'll be some, please, I'd encourage anyone to connect.
Connect.
You know, and you bring up a really important point as well, that, you know, sometimes it's not about the services not being available. We have a lot of services in our community.
don't know.
I'm not saying we have enough.
Right.
But we do have a lot in this community. We would be the envy of a lot of other communities. But it's the connection. Again, it's making sure that we all know, and those resources that can be brought to bear, and people like you that have connections with our neighbors in order to do that as well. So you're in the right place. I'm sure that folks will absolutely reach out here. But
Thank you.
I'd also suggest connecting with Department of Senior and Adult Services as some
And
of that
thank
as
you
well.
for that, because it
Yeah.
is important. I
Yeah.
see it. That I
Yeah.
retired from that industry.
You didn't really retire.
I didn't retire.
I mean-
but that's my way to not being isolated in the house.
Good for you. Thank you.
Thank you.
Thank you for doing that. Yeah. Hi.
Good morning, Emily. Thank you for your presentation. My question is, do you have a suggestion for how we can help seniors who are being disconnected by telephone because of nuisance calls? I work for the Department of Aging, and a lot of times my outreach to seniors is via the telephone. They don't answer their phones, and most of the time they tell me they don't answer because they get calls from people who want to buy their homes, people
Yep.
who want to offer them things, possible scams. And do you have any suggestions on how we can handle that?
Yeah, that's a tough one. So one of the things that I will say is that Community Solutions has seen in our data over the last decade or so a real change in how older adults are getting information and how they are connected. So, 10 plus years ago, it was all phone. It's all phone and it's all flyers. It's all physical mail. Those have fallen off for some of the reasons that you indicated, and we're seeing more and more older adults that are getting their information through electronic means and through some of those things, much more digitally connected as we see the older adult population sort of changing and the next generation coming in and those kinds of things. But we find time after time after time after time, the thing that older adults say they prefer, the way they prefer to get information, or the most common way that they get information is word of mouth and person to person. So, one of the things I would say is that if it is somebody with a cell phone, to ask them to put the contact in their contacts so that when it comes up, they know it's someone that they want to hear from, not one of those nuisance calls, and kind of helping folks to do that. That's a little bit harder when we're talking about landlines, but a lot of people now have caller ID, so publicizing when we call you, this is what will come up on your caller ID, and you may want to pick up. I think is a very practical way to kind of get the word out that we're a call that you may want to answer. And these are with people that are kind of already connected with you in some way. It's a little bit more difficult if you don't already have that relationship with someone, but it is. I don't have a wonderful answer because we are all feeling it. And I think the deluge of things coming at us make this a little bit more difficult, so that our individual reach out and feeling like there's a place to go and call becomes even more important, so that we can do it when we need it, not have it be part of the deluge coming at us. Yeah, great. You bring up a great point and a real challenge.
Hi, Emily. I'm thinking about neighborhoods and the way our neighborhoods are built, and if there's data on how that impacts isolation. I can see my neighbor's house. I mean, I can see in their window versus I live in the city versus in other communities where things are more spread out. We might not run into each other so much.
Yeah, so that's one of the things that is being pointed to for the sort of bowling alone changes, for some of the societal social isolation that we're seeing, is the way that neighborhoods and communities are built, sort of, especially when we're thinking about further outside of the central cities. You are also seeing that people desire that. Those communities that have that connection, that have the walkability, are becoming more desirable. And, the advent of the lifestyle center, the Legacy Village, the Crocker Park, where you're sort of out and about, you're seeing people, are a way for developers and others to try and have that happen in other places. But that is an important component of it, and it means that barriers like transportation are even more difficult the further out we get from the central city, where there is even less things like public transportation available, where you have to drive a significant distance to get to the pharmacy, to get to places where it's like an event to really do just about anything. You can't just walk outside of your house and see people. But that connection is something that people are craving, and we're seeing some of those more walkable communities, some of those more inviting, engaging communities where people are sitting outside saying hi and waving to their neighbors as being desirable. I think one of the challenges here is making sure that they continue to be affordable and available to people of all ages and to people of all income. And it is something that Cleveland does quite well on. Our older housing stock is not always a benefit, but in this case, the fact that the homes are closer together, the fact that we have sidewalks, they're not always in the perfect repair, but we have them, and a lot of communities don't, that make it even more difficult, and there are opportunities to get out and to do things, and we have a robust, senior transportation connection, and other work that I know you're supporting at United Way to kind of help people that may have barriers be able to do some of those things. We got a lot of churches. We saw how important people's faith-based groups are. 45% in Summit County rely on that. So, we have the things here in Cleveland. It's a matter of making the connections and making sure that they're accessible to all. Great question. Hey, Will.
Hey, good morning, Emily. Great presentation. Really enjoyed it. And I really appreciated the question about the phone aspect of things. I want to give a shout out to the county scam squad as a resource to help people who encounter those telephone calls. My question is actually a follow-up to something you just talked about.
Oh, perfect.
The importance of the faith-based organizations. During the pandemic, we saw the disproportionate impact of the pandemic on the Black community in both illness and in death. But we also saw the role that the Black church played in Black livelihood. It wasn't just going on Zoom, but church is a way of life. And I'm wondering if you could speak to the importance, especially when we're talking about the impact of faith-based groups and loneliness, of cultural sensitivity in data, and how do we reflect the role of institutions like the Black church when we're examining the impact on social isolation and the role they can play in helping to address it?
Yeah, well, there's a lot to unpack. There's a lot to unpack in that question. But yes, we see, especially in the Black community, the role of faith-based organizations. Another place that we see that it's very strong in Cuyahoga County is also among the Jewish community and the strength there. So, you know, these are strong and important places that people connect where they feel like they belong. And I think your question about cultural sensitivity really gets to a feeling of belonging. And thinking about what are people comfortable with, kind of meeting them where they are, what feels like too much or a little scary, and what are those first steps that people can take in order to get in and get involved. But that's, you know, these are independent choices, and each person is different. There's not a one-size-fits-all answer to some of this. And so a piece of what I hope we kind of think about, especially as we move into the panel and talk about a little bit more, are making sure that there's a variety of things available so that people can connect where they feel most comfortable. Faith-based organizations are absolutely an important place of that, especially for those who were like forced to go when they were kids. And even if you don't really want to go, it still feels comfortable because it's familiar from your past, you know, and people rediscovering some of those connections. But there's formal and informal networks, right? So the senior centers are one thing, they're vitally important. Faith-based organizations, churches are another, libraries are a third, wherever it may be, social clubs, community centers, book clubs, those kinds of things are helping people figure out where they feel like they most belong and where they feel, frankly, safe. You know, this is about feelings of safety, because you are not going to feel like you're not lonely if you don't feel safe. Yeah, great question, thank you. All right, we are at time, right? Perfect. Great, well, thank you all so much for your time and attention today. I'm delighted to be here, and thank you so much. And don't forget to talk, if you don't know somebody at your table, I'll take a page out of Dan Moulthrop. You can do it right now to get to know each other. But this is social isolation and loneliness is an issue that we can each individually and collectively address and work on, and it has so many benefits. I think it may be one of the ingredients of the secret sauce. Thank you.
I was going to ask, but I didn't know if I was allowed. But as a senior myself, with a smartphone and a small smart television, I can't tell you how many times I've had to call my son in Colorado or my son in California. I don't know how to work this. I would hope that there would be a partnership with high schools. You have that, yes? Or could?
I think individually some communities have done that.
Yes, individually some communities may have done that. I just think that that would be a wonderful thing, because they say as you get older, the way you stay younger is to keep up on technology. And I stopped getting the Sunday paper just because I couldn't understand the Best Buy circular anymore. So anyway, just 2 cents from me, you could send somebody to my house too. And it's also a wonderful reminder that I think so many of us when we're young, maybe we forget that someday we're going to be that person, you know, who's walking with a cane. And thank God he's always reminded me that I'm going to get there, and here I am. So thank you so much, Emily, for that wonderful, wonderful report. Now, I am very excited, and to know that smoking and drinking isn't just going to kill me, it's the isolation. Just kidding. Oh, 15 cigarettes a day. My mother would have loved that. All right, she smoked like a chimney. That being said, I am very excited to introduce our moderator and panel of experts who will guide us through the discussion and share their valuable insights on the topic. The discussion will be moderated by Emily Matillo, Director of Research and Williamson Family Fellow for Applied Research. Easy for me to say. Joining her are 3 exceptional panelists: Vanessa Jackson, the Senior and Wellness Manager at the May Dugan Center. Give a little wave there. Catherine Rush, a Senior and Disability Advocate. Alyssa Peters, a clinical social worker at the Veterans Affairs Northeast Ohio Healthcare System. Please, everyone, welcome Emily, Vanessa, Kathy, and Alyssa. Take it away.
Thank you. You know, one thing that has become very clear in this day so far is just how much humor can connect us, right? Every time Robin or Chris or Emily made a joke, I think we all laughed a little bit and felt even a little more connected to those in this room. So I deeply regret not asking you guys any funny questions ahead of time, but we'll do our best to follow the acts that have come before us. We've heard so much today about social isolation and loneliness from people who run the programs, from people who study the issue, and now we get to hear directly from people who are working with older adults and people with disabilities. So my first question to the panelists, in your work, how have you seen social isolation and loneliness impact mental health and physical health? And is there a difference of the impacts of social isolation versus loneliness? Well, let's go Alyssa to go first.
So I work at the VA, I work in memory care. So I serve veterans who have a diagnosis of dementia or are experiencing memory thinking changes. And it's been alluded to several times today, is just how much isolation and lack of just that cognitive stimulation that comes with interacting with others affects brain health over time. And so seeing things such as simple conversations, you know, problem solving with others really has a long-term effect on brain health and ultimately increases the likelihood of things like developing dementia.
Yeah, Catherine?
Okay. Before I say anything else, the lady in the gray dress there, yes, I just want to tell you, you are not retired, you're rewired. Okay? That's my claim to fame, is I am not retired, I am rewired. Okay? Okay, so to answer the question, I currently work as a life enrichment instructor for the Loving Hands group, and the founder is right over there. Thank you for coming, Judith. And I work with seniors and people with disabilities, and we go to them. And what I have seen through the years of doing this, which I'm on my 7th year, I believe now, Judith, I think 7th or 8th. Again, I'm not retired, I'm rewired. Okay, good, yeah. I think we all need to get t-shirts, right? Okay, even prior to COVID, there was a group of independent living people that I would go to, and they would almost like run to the door because they couldn't wait for me to be there. So social isolation and that it's been there even before the pandemic. They couldn't wait to see me. The classes have given them a chance to be creative and to be with others. And being creative helps them to socialize with others. And I look at social isolation and loneliness through the lens of creativity, just because that's creativity. People, we're wired just a little bit different. But they get to learn new things, they develop new relationships, and again, each month they met me at the door. So I think that, to answer the question, I just think that, that it's been there for a long time. But it is a big issue. One of the things that I wrote down, Emily, I took a lot of notes. Okay, I'm running out of ink. But the social isolation to me is, the word that goes along with that is connecting. Loneliness, to me, the single word that goes with that is belonging. So I think those two go hand in hand. So,
yeah, thank you. Vanessa?
In the work that I do at the May Dugan Center, we have an adult development program. I've been there for about 7 years, and we started out with about 5 individuals who were connected through our food and basic needs programming. That gave them a sense of belonging initially. As the program grew and we got to know the participants more, we started trying to tailor the program to their interests, to get them to experience a lot of the things that they had put off during child rearing in their working years, you know, to get back connected to their creativity, to get back connected to advocating for themselves or serving their communities. And these were ways that they bridged social isolation. It gave them a sense of belonging. It gave them a sense of connectedness. During the pandemic, we had, fortunately, the December before, gotten a grant from AARP to get our seniors both tablets and internet access. So when the pandemic hit, we switched to virtual. And for 2.5 years, we worked with seniors to be virtually connected. We also did food deliveries, deliveries of activity packs, to keep the social isolation at a minimum.
Yeah, thank you, Vanessa. And you know, we heard some answers about creativity in there, right? And I think that is such a strength of this network, is being creative in the face of challenges. So I'm wondering if you guys could speak to sort of the biggest barriers and challenges to getting people to be socially connected, to have those feelings of belonging. What's preventing that from happening?
I think one of the most undersold barriers is incontinence. I think a lot of older adults avoid leaving the house, social situations, new environments, because they don't know, where the bathrooms are. They have a lot of embarrassment and anxiety about having an incontinence event in public. So I think that that's something that we undervalue and don't always recognize. And so, having those conversations with your medical providers, and just with caregivers of how can we make you feel more comfortable when you are out and about. Could we check out where the bathroom is before we get settled in the main event space, whatever it may be. And I just think also, it takes many older adults so much time and effort to just get out the door. And so by the time they're dressed and ready to get in the car, they're over it. Like they've cashed out all of their energy chips for the day. And so because of that, they avoid even committing or actively seeking out social opportunities.
Yeah, thank you. Catherine, I'd love to hear your perspective as well.
Okay. Weather, I think, is one of them. We can all say that right now. I personally, I'm one of those over 65 people. And the more I walk on ice, the less I like it.
Yeah.
I used to be really good on ice skates, not anymore. So I think the weather does play a part of it. Some of my other observations and conversations is cost. A lot of people don't have the money to do things that may have a cost related. So they avoid it because of that. Transportation obviously is an issue. Sometimes the fear of the unknown, not knowing anybody, not knowing what to do when they arrive, how to engage. Are there going to be anybody there that they like or that they know? Are they going to feel like a fish out of water? One of the areas that we had hoped to have as another panelist was somebody from the grieving community from Cornerstone of Hope. And I think that is one of the areas, barriers as well, is people that are grieving, especially the spouses, that they go from a couple's world to a singles world. And I've done grief counseling for years and years, and that is a huge barrier for people, that they no longer fit in the couple's world. Somebody who's lost a child or a parent may be grieving terribly, and they're supposed to go and be social, and they just can't put on the front. So those are some of the barriers that I don't think we really think about very much, but those to me have been some of the barriers that I've run across in all my years.
Yeah, grief and loneliness.
Yeah.
Yeah, just feeling misunderstood, I have no place, that to you the world has stopped, but
Right.
to everyone else the world goes on.
Right.
And grief and loneliness are not a protracted 3-week, okay, I'm gonna get over it. Sometimes grief and loneliness goes on for years and years. And having the understanding that someone is there for you in that time is really critical. A couple of things that my colleagues haven't mentioned. One is literacy. We have a lot of older adults who do have literacy issues, will not admit they have literacy issues, You give them information to read, they can't read it. You give them information on their tablet or cell phone, they can't read that either. They just don't come. The other is safety. Many older adults slow down, their mobility, even if they are ambulatory, is not what it used to be. They cannot run if a criminal gets behind them. They see the news and they are concerned that they won't be safe in an Uber, that they won't be safe on a bus, that they won't be safe on the street if it's dark and the sidewalk is cracked. So having real safety protocols that address the needs of our seniors as part of the Livable Cuyahoga Initiative, I know that's a part of it, that will help our seniors to be able to engage more effectively.
Yeah, thank you. I think those are some barriers that are not often mentioned, right? We often are talking about, we talk about transportation or we talk about mobility, but these are some of those deeper issues that you only really know when you're working in it and seeing it day to day. So thank you for sharing those experiences. Vanessa, I'm going to start with you because I know May Dugan has been such a leader in being innovative and taking risks and being willing to try something new when it comes to drawing older adults and people with disabilities into your programming. Can you talk about some of the services or programs that you've seen be most effective in drawing in some of those folks who might be hard to reach?
May Dugan Center has a lot of wraparound services. We have a food and basic needs program. We have all types of behavioral health services. We have an education resources center, as well as our senior program. Part of our education resource center is a financial literacy program. So we are able to draw seniors in through our different programming, and if they are in the clothing room and they say, I am really having a hard time managing my budget, somebody says, we have a financial opportunity center, you want to check that out? Go to the front desk. They get involved in that activity. Once they get involved in that, they learn about other programming there. Maybe they come in through the behavioral health portal. We have music therapy, art therapy, and we are going to be starting a grief support group just for seniors as well. Through the program that I run, the Seniors on the Move, we get out into the community, we take trips, but we also bring in all of the May Dugan program directors to make sure that our seniors are well aware that they don't have to go outside of our doors. If they need help, they can just go to the front desk and say, I need help with X, and we'll get somebody to help them right away. We have a one-stop shop intake process, so they don't have to go through intake over and over for each program. And I think that makes them comfortable to come in and share really what it is that they need so we can help them.
Yeah, Catherine, I'm wondering if you have any thoughts from your perspective.
In teaching the life enrichment classes that I do in my long time working in this field, it's been beneficial to see that when people do get creative and get together, they start talking to each other. And I know Aaron over there, I know can attest to that in some of the classes that I've taught over there. The people are talking to each other. They start developing relationships because of a common goal. They're doing something together, and it's sparking conversation. But creativity does not always mean making something either. Sometimes creativity is just getting together, sharing ideas, just seeing people talking. Sometimes when a craft or an activity, life enrichment activity that I'm doing may feel too challenging for somebody, they may just sit and observe and socialize. And that has been so beneficial to them. I asked some of the people that I work with, I asked them, what do the classes mean to you as far as, feeling apart or feeling less isolated? And several people answered my question, but one in particular that I asked
and I want to read her quote because it was just so interesting. I asked her what the classes do for her, and she said, when I'm in class, socializing and being creative with other people, I forget my aches and pains and all the negativity around me, and I get to relax and enjoy myself. I thought that that was so profound, that she forgot about her aches and pains. She didn't think about the negativity because she was doing something and socially engaging with others. And again, one of the things that Emily said, you mind if I quote you? Okay, good. I'm going to anyway. It doesn't matter. Okay? You talked about connection, or informal connection is key. And I think about my own father. He was not one to go to a senior center. He was a construction worker. Go to a senior center. What's the matter with you? He did actually in his later years because of the free food. That was all it was about. It was the donuts and the free food. That was all it was about. Yeah, it was. It wasn't about socializing. It was about the donuts. But he used to go to Hardee's and meet with his, as he called them, his cronies. Okay, so going to a coffee shop. Something as simple as that, going to a library, something simple, just that we may not even think about, but it does reduce social isolation. So those are some of the things that I've seen.
Yeah, I've heard of this idea of like office hours.
Yeah.
So you're my friend, and I'm gonna be at this coffee shop on Tuesdays from 1 to 5, and it kind of being just an open house where people can come and connect with each other, briefly and just get moving on. I think that, the meetups at McDonald's, that was my grandfather's, was McDonald's, is a great opportunity to informally do that. You stole the point about food. Food brings people together, and I think it makes people less anxious about, well, what am I going to do when I get there? You're going to get a plate of food, and you're going to sit down and you're going to eat. And I think also encouraging, don't sit with the same people that you've always sat with. Getting people to interact with each other, to avoid that kind of clickiness that can kind of offset people sometimes.
Beauty shops, barber shops, those are places where people gather.
Yeah.
And maybe those are people that we need to bring into the conversation, because the people who run those institutions often hear about needs in the senior community that they are not willing to share with other people. You tell your hairdresser a whole lot of stuff that you don't tell nobody else. So as we look at serving our growing senior community, we also need to look at who's around the table and who can we bring in that might have a different perspective, that can offer us different outlets for service as well.
Yeah, I think it's so interesting. I think we've accidentally started a conversation about third spaces in our community, and those spaces that are not work and not home, but are here for us to gather, and they can come in many different forms. They can be libraries, they can be beauty shops, they can be McDonald's, and making sure that those third spaces are supported and exist is crucial to this idea of social isolation and loneliness, but I'm not sure that's always talked about enough in our community. We've talked a little bit about belonging and how important that is, that feeling of belonging and creating environments where people feel they can belong. How can social service providers ensure that they are offering culturally competent environments and services so that all people can feel included? We'll start with you, Alyssa.
Yeah, I think when you're with programming, and we kind of alluded to this, just being very mindful of how and where you advertise your services, or recruit for people to become involved in the community. Don't just go where you go, where I go, right, as a white clinician, but go to where our community is, where they go, and that's a way to just represent the full cultural diversity in our services. Yeah, we tend to seek familiarity, and that's even within our programming. And so we have to be mindful of these really informal spaces that really capture a huge portion of people that need that connection.
Catherine, I'm wondering if you can speak to sort of the community of people with disabilities, maybe specifically developmental disabilities. I know that you have a lot of background in that, and that's a population that I think sometimes gets overlooked, especially as they age.
Yeah, they absolutely do. Yeah, people with developmental disabilities, people with disabilities in general, but especially people with developmental disabilities, are often ignored.
Othered.
Othered. I've been doing this for 45 years. It's those people over there. I actually wrote a book about the challenges that families went through back in the 60s when they had a child with a disability. It was a shame to have a child, and there's still some of that stigma out there. I was talking to somebody recently, and I didn't have this written down, but I'm going to give it to you free. I'm not going to charge you for this one. Okay. There was somebody that runs a residential group home, kind of facility. Has several group homes, and she went to the license branch to get the licenses renewed on the vehicles. And the person behind the license branch thing said, what kind of business do you run? She said, I run group homes for people with developmental disabilities. And the woman was appalled. And she said, you let people like that out? I mean, has she been living under a rock or what? And she said, well, they live in the community. And she said, well, what do you do with them? I mean, it got worse, okay? I'm just saying, it got worse. So, again, there's still some stigma out there with people with developmental disabilities. They long so much to belong, and they are so marginalized that they oftentimes do not get to join in. They don't get to belong. One of the things that I have had the privilege of doing, and that's how I got into Seniors World, is back in 1989, I looked around one of the workshops I was working at, and we had people that were in their 80s still working at the workshop. And I'm like, these guys deserve to retire or get rewired, right? They deserve to retire. And so I started pushing the movement of people with developmental disabilities and seniors being allowed to go to senior centers. And it became a national movement, and that was just because I have a big mouth and I made it happen. But people with developmental disabilities absolutely want to belong, and I know that Erin, I'm going to point you out here, okay? Erin does a group with people with developmental disabilities through the senior center, and I think it's very successful. So I think integrating people with developmental disabilities, it doesn't have to be a whole group. You do it one at a time. That's how we were successful with integrating seniors with developmental disabilities. But they absolutely want to belong. I teach a class at the Art Museum every other week by way of the Loving Hands group, and it's people with disabilities that come to the Art Museum. And I have to tell you, Judith, yesterday when I was at the Art Museum, I was teaching on Alvin and the Chipmunks because they requested it. And so at the beginning of the class, there wasn't anybody else in the atrium except us. And so I started playing the Chipmunk song on my phone. So these people were walking by, and they all stopped and started singing the Alvin and the Chipmunk song with us. So it was just a great opportunity for us to mingle with the community a little bit. So hopefully that's a long-winded answer to tell you that they want to belong, they desire to belong. They're not, so different from everybody else. They just happen to have some limitations here and there, but don't we all?
And I think with all of the populations that we're talking about, all of our efforts have to be intentional. There are many people who don't know anyone who has a disability, who haven't interacted with them on a personal level, and that is really a shame. Because when you get to know folks, then you know folks, and you know their strengths and their weaknesses, and how funny they are, and what a delight they can be in your life. But you also have to be intentional about culture, about literacy, about incontinence when you are creating these programmings. One of our rules is we've got a couple of people who use motorized wheelchairs. One of our rules for outings is if the motorized wheelchairs can't go, we can't go. because everybody has to be able to participate. So I think that really being intentional, not only with your programming, but also with your participants, letting them know is really important.
Yeah, thank you. I used to live across the street from May Dugan Center. Now I just live a couple blocks away, and it's such a beautifully diverse community. And so I really appreciate that, the efforts to make sure that everybody is included in that lovely community. Earlier today we heard about the program at Western Reserve Area Agency on Aging that they've done in collaboration with Benjamin Rose, the telecare calls, I think I've got the name right. And I think that's a really good example of how a technology that we all know how to use, phones, has really helped in reducing social isolation and loneliness. And I'm wondering if there are other examples you guys could share of how technology, either new technology or tried and true technology, has played a positive role in this issue.
So we've talked a little bit about the importance of that intergenerational connection and how valuable that can be. And I think technology is a natural place that we can promote that. And in my practice, I talk a lot to caregivers, and I really encourage them to leverage technology as much as possible, particularly to keep their loved one at home safe for as long as possible. So there's very simple things that we can do, like the digital photo frames that change and you can see family members throughout the day. Social media, daily calls and check-ins are very important. I know my grandmother loves Snapchat because she could see her great-grandchildren every day, and it was such a great connection for her. So taking the time to set that up on your loved one's phone and showing them the most simple way to use it Snapchat was a huge part of her life. It really was, and how she stayed connected to her great-grandchildren who were far away.
During the pandemic, I had the privilege to do some classes by way of Loving Hands through Zoom. And while I'm an in-your-face kind of person, anybody who knows me in this room, I'm in your face, okay? But these people hadn't seen each other, and so in the Zoom class, they were so excited to be able to see each other and actually have some conversations. So I think that was very beneficial during the pandemic, and sometimes there's still not opportunities to get together, so Zoom and Teams and whatever, that's a good opportunity for them to interact. Additionally, I see a number of people with their smartphones, including people with developmental disabilities, using their smartphones. Yesterday, one of the individuals at the art museum asked me if I could download an app to change his voice on his smartphone. He wanted to sound like a chipmunk. Hey, I was teaching Alvin and the Chipmunks, okay, what can I say? But, it was just so important. And then I'm friends with a number of people on Facebook who have developmental disabilities or are in their 90s. There's a woman I'm friends with on Facebook who is 96 years old, and she loves being on Facebook. So I think technology plays a big role, and thankfully we have the technology now to be able to do different things like that.
Mm-hmm. And we can't assume that older adults can't do technology.
Absolutely.
No doubt it can be frustrating. I do a lot of telehealth, and it can be frustrating, but I think that we assume that, Dad can't do that, and I think that that's unfortunate because it's a missed opportunity for connection.
Our senior program does have their own private Facebook group so they can communicate with one another and I can communicate with them. We do send out emails as well, but technology can be used in a lot of different ways to create connection. Intergenerationally, you can have your children, grandchildren, whoever, look up a recipe that you can cook together and talk about what that recipe means to your family. Often activities, knitting, sewing, those types of things create opportunities to use technology. Maybe you're teaching, maybe you're learning. So it gives seniors an opportunity not only to use technology, but to contribute and to continue lifelong learning. So I think there's lots of ways that you can use it creatively.
Thank you. We do have some time built in for the audience to ask our panelists some questions, but before we get to that, I'm just going to ask one last question, and this wasn't prepared, so good luck. And really the question is, I've asked a lot of questions, we've heard so much today, but I'm wondering if there's anything that we haven't touched on, that wasn't in one of my questions, that wasn't in any of the presentations, that you would like to bring up. And because this wasn't prepared, I'll like say a few words so you can start thinking and moving along, and I'll share that. I have a grandma who's 93, and she lives with my Uncle Mike, who is 66, and he has a cognitive disability. And I am absolutely positive that those two are keeping each other alive. They are each other's person. They are a funny little duo, but they keep each other going. And so I think those connections throughout the life really keep people together. Okay, so now you should have some time to think. Is there anything else you'd like to share that we haven't touched on?
One thing that came to my mind when I was, preparing was this idea of touch starvation that happens a lot with our older adults. They can go days, weeks, months without having any physical contact with anyone. And so I think that in COVID, multiplied that because we had to stay apart from each other, particularly, older adults who are at risk for negative outcomes. So I think I know that my clients, they love to hug goodbye, right? And, earlier in my career, I didn't really like to touch my clients, right? Like I just wanted to keep that distance. And more I feel that, just that touch on the arm, getting down to somebody's level versus talking over them, the hug goodbye and the handshake, those are all very important to our older adults. And we don't give that enough weight, I think.
I would agree with that, actually. I didn't think about that, but that's, in the field of developmental disabilities, we were always told, no hugs or anything like that,
Yeah.
and, you just stay hands off.
Yep.
And I do lots and lots of training in the Alzheimer's arena, and one of the areas is Alzheimer's is a very lonely disease.
Yeah.
And not only for the individual going through it, but for the families and caregivers as well. And I always would tell people, one of the most important things that you could do is the touch therapy, is get those, the Bath and Body Works, it smells so good, and get the creams and just do, just a hand touch and things like that. My aunt recently passed away from Alzheimer's about less than a month ago, and one of the last times I was with her, I held her hand for probably 15 to 20 minutes and just rubbed her hand, and she stared in my eyes almost the entire time. It was probably one of the first times she, except for her kids coming by and giving her a quick hug or whatever, but to actually have that physical contact. So I think that the touch is really, really key because people are starved, and we need that.
Yeah, and touch can become very mechanical if you're caregiving all the time, right? Just transferring and, okay, I got to get done to this bath because we got to get to the meal. And so being mindful of increasing that kind of one-to-oneness and not just being goal-directed for caregiving.
I actually have two. In my senior program, the youngest person is 50 and the oldest person is 101. So that's a 51-year age gap, but all of those are older adults. And that means that older adults are not a monolith. One size does not fit all. We need to be specific and use this huge community that we have to look at the folks who are falling through the cracks and find a place for them.
Thank you, thank you. I'm so glad I asked that question because those are such important things to think about. Do we have any questions from the audience?
I got there first.
Good morning. My name is Heidi and I'm with Hospice of the Western Reserve. And it's kind of a twofold when we talk about the technology and not assuming that older adults can't use the technology, but recognizing there's some older adults that don't want to use the technology. And we have created a system now where we're trying to force upon them something they don't want. You have to use MyChart to make appointments. You have to use QR codes to get programs. You have to do so much that is technology-based. My grandmother lived to be 99 and a half. She did not want, nor need, nor desire a computer or a smartphone. And yet, when she was trying to get her new set of benefits, all the paperwork that came in had nothing but URL codes, not a phone number in the bunch. And then we think about how scammers are using the technology. And so we're pushing them into something that's making them even more vulnerable, because if they don't know how to properly determine what's a good QR code versus what's a scammer QR code, they are now exposed. And so how do we address that to make sure that we're not setting them up in our efforts to try to connect them?
One benefit Cuyahoga County has is, did you want to answer that, Wanda?
Yeah, only thing I said. And the reason being is because I had to go all the way back to 22 years ago when I started training seniors how to access and use technology for their own benefit. And today, I'm still training as many as I did way back then, because we keep aging up. And actually, I'm one of those now that have aged up too. But the only way to combat what you just talked about is for continued education, and you spoke about it, lifelong learning. You know, we have to never stop learning. And this is what I talk about more in our technology class than the actual physical hands-on with the devices, is that we must continue to have lifelong learning and that they can learn. I've trained over 10,000 seniors throughout the years that said, no, I don't want this, I don't understand it, I don't want it. But once they find the value of what the technology can do for them, they adopt. Now, they may not want to do exactly everything that I would love to teach them, but what they do learn is what they do keep, just like everything else. So don't get despair. If you have a group that needs to be exposed to technology, what it can do for them and how they can make that telehealth appointment, then call me. Call me. I'm Wanda Davis with the Ashbury Senior. And so I've had the opportunity to be connected with Veronica and a few other senior centers, Ben Rose, CMHA, HUD Housing, and you know, we 10 years ago said, let's take this beyond the walls, because you know, everybody can't come to little old Ashbury. I call ourselves the little engine that could, that would, that did. And so we have kept that going for that 22 years. And so, you know, we're kind of threatened a little bit now. But we will find ways to keep that technology growing. And so if you need me, call ASC3. Hi. Thank you.
I think we have a question in the back.
Hi, I'm Sylvia Plow-Wraith. For those of you who don't know me, and I work at DSAS as the Deputy Director of Community Programs, and one of the programs I oversee is our Adult Protective Service Program. I would be remiss if I didn't bring up the fact that social isolation, today we learned a lot about how it impacts emotional and physical well-being. But one of the things that I learned over the years in my career is how it also makes people vulnerable to being abused, neglected, and exploited, and yes, scammed, which, so one of the things, maybe next time we can talk about, like we just talked about technology, and I heard behind me, yeah, technology is one of the fastest growing way I'm gonna call them bad guys because I can call them something else, go after their clients. Because what we learned through the pandemic, when Ohio opened back up, one of the things that we learned that every type of abuse and neglect and domestic violence cases grew during the pandemic. We didn't find out about it till after Ohio opened back up. And I think this is where we learn that. We think about dementia making older adults vulnerable, but in reality is how alone and isolated are they is what can make them. And we have to be careful when we offer them technology, because yes, we want to teach them. Because the other thing I want to say real quick is we think the scammers, what makes an older adult more vulnerable to being scammed is not having awareness of having good technology, like a good computer, having your browsers up to date. So it's not just learning about how you're being attacked, but how do you keep yourself safe when you're using those technologies? So maybe that's something we can do next year.
Yeah, it's
Because
a
this
great
conversation needs to continue.
That's a great topic. Yeah, as a clinician, I do a lot of training and education on scams, and I think that we don't do enough. And it needs to be ongoing. It needs to be a regular part of your assessment with your caregivers and patients. Have some practical things that they can implement to keep themselves safer, and not just say, don't answer the phone. You know, we need to have, and just in the same way we can't assume that they can't do tech, we also can't assume that they can decipher between good and bad intentions with the right education and awareness.
I think too, the social connections that people build through all of these different ways we've talked about, give them someone to call and say, hey, the IRS just called, they need all this information from me, should I give it to them? And have someone who can, without judgment, say, no, please don't. You can hang up on them, you can be rude. And so these connections are what prevents some of those scams.
And we also need a multimodal approach. We have brochures that tell them how to do things. We have the Cuyahoga County Scam Squad come in 2-3 times a year to update us on the newest things that are happening. And we have to respect the people who just say no. There needs to be a trusted source within your program organization that person who does not want to engage with technology can go to get the technology help that they need. We have to respect that. There's just some people who are not going to adopt, and that's a fact.
And one more thing to that, we also know that when they do come together to learn technology, some of them won't pick it up like you said, but they learn, they share the scams, and they share the information that they are receiving. Thank you. And so they share, I was saying, you know, that the fact that when individuals come together, especially our seniors, and like I say, I'm one of them, and when they come to class, a lot of them don't come just for the technology piece, they come for the socialization, to keep from being isolated. And through that, they learn about what's going on in the world through each other, because I think our peer learning has always been the best teacher of all. And so when we learn from each other, we usually retain it. And so they share scams that they have been asked to participate in. They share scams that, you know, their other friends have gone through. And so through this intercommunications is where they get the most value. And that's when I speak about value. When we do that 8-week class, and they say, oh, some people say that's long, but the class is there for more than just the physical parts of learning technology. It's there for the socialization and for the peer learning, and that's the best way to learn for me.
Yeah, I think we have time for one more question.
Oh, sorry. Hi, I'm Deirdre. I'm a social worker at Metro Health. And just to piggyback on what everyone's saying, because I think it ties in directly to loneliness, I've just seen a lot of pervasiveness in romance scams with our populations. And I just think further education, because it's just so easy to send money via Facebook and all these apps, and that I just think the populations we work with are just so susceptible because they're so lonely. So these people that are willing to text them once a day even, just I think further education and even more programming behind that, because they don't understand like stock pictures or AI, how easy it is for someone to send them a Google image of, you know, a child that doesn't have food and saying, oh, this is my grandchild and they need to be fed. Just things like that. I think really, if we could all band together on that, the scamming is just everywhere.
Yeah.
And now it's dead. Oh, here we go. So just because I have the microphone, I'm going to take this opportunity to say, again, thank you to everybody in this room. And not only have you heard our speakers talk about great things, and we all learned a lot, I think we've also found this is a really great opportunity to meet another person and collaborate. And so in that spirit, I'd like to say, I've worked at the Board of Developmental Disabilities, met Kathy there for 29 years, and we have an entire department directed solely towards making community organizations more accessible in their physical spaces and inclusive in their programming. And not only does that not help people with developmental disabilities, that helps people of all abilities. And so I'm here to say, whatever consultation, resources, support, education, training, anyone in this room needs to be able to be more inclusive of that population, we are happy to provide that 100% free. And also, we have invested in 2024 in 15 new universal changing tables all across the county. So if you serve people who have mobility issues and who need those types of accommodations to be able to access their community, you can go to changingspaces.com and they'll tell you where all of those new tables are.
We're free. It's my time. As my son used to say when I'd turn off the car too soon before I got in the garage, and I'd put it in neutral and have him push me in, he'd go, "It's my time to shine." Oh, ladies, thank you. Thank you so much. Emily, Vanessa, Kathy, and Alyssa. Great, great job. We've got to wrap this up so that you can all get on your way and stuff your pockets with sandwiches there in the back. Natasha, would you please join us once more to share with us how we can stay connected and get involved with DSAS?
So there's been a lot of information shared today, and I think that one of the points brought up was that we're sitting at tables with people that some of you we know very well and some we don't. Some we'll get to know better. But I think the key here is a lot of this partnership. We've talked about a lot of heavy stuff today. Like really it is. When you think about somebody that might be suffering or lonely, as a compassionate person or anyone who's in health and human services, you know that that pulls at your heartstrings. And you get energized, hopefully. So you leave here thinking, wow, who did I meet today? Who can I talk to later? How do I re-engage and reconnect people to services? So even though the topics were heavy, I think that there's a lot of hope too in the air, just listening to people share ideas. So take that with you, internalize it, and think about the sky is the limit, right? We can always adapt and look for new programming, and it's not always financially based, right? Sometimes it is just putting good ideas together and finding ways, looking for grant opportunities. But the first step is that conversation. I again want to thank people, when you do something well, part of that curse is you are asked to do it again. So Robin, you may be getting a call from us again next year. So start thinking of your material, but thank you. You did another wonderful job just getting the energy moving on a Friday that's snowy in Cleveland. Meridel and Tanisha. Meridel, she oversees all aspects of our board, and Tanisha Washington is in the back. She's one of our comms people. You guys always do an excellent job. You're very meticulous trying to plan this out and think of all the different things to accommodate everybody, so thank you. Our board, again, this is the reason why we are here today. You're wonderful people, and you are allies in this fight with us. We truly respect everything that you do for us, as well as the communities that you're servicing and the programs that you're running. The DSAS staff, the team is wonderful, so there's many of them here today. And again, I work with a group of highly dedicated people who really do take pride in the work that they're doing. Our presenters, thank you. Great, my phone's ringing. And it was a 1-800 number, so I'm sure it's not a bill collector, but it's somebody that I do not want to talk to, probably. The Emilys, we talked to them a lot. They've been on this journey with us quite some time. Ever since I became even the interim director, I've been dealing with community solutions on a different level, and they helped us initially with our assessment that we did with our age-friendly livable Cuyahoga. So it was wonderful, the information you shared, Emily Campbell, and then just the moderating that you did and just sharing some of your personal story, because I think that's very important. She is a grandmother and she is an uncle, and people do support one another, and it makes you wonder what happens when that dynamic changes, right? God forbid. But these are realistic conversations we have to have. You know, we have a CSSP program, our Community Social Services Program. That is one way that people can maybe look for some funding. It's not a huge pot of money. It's about, well, I know what it is exactly. It's about $3.2 million that we offer to fund several initiatives in the community. We do a lot of senior centers where we give them money for congregate meals and adult development programs, but that RFP is coming up soon. So that might be one opportunity for something you've heard today to bolster an idea that you might bring back to your center and your community. We also convene the Cuyahoga County Senior Social Services Network. I know the lady at from Silver Connections, she mentioned Denise's name. Denise is somebody that, you know, one of our colleagues, and she helps oversee that program and pull that together. So that's another opportunity to connect with other professionals, right? To, again, have ideas. I think, you know, last year we wanted to do a grant through AARP, and it was bringing East Side and West Side together, right? And we didn't unfortunately get the funding for that grant, but somebody mentioned that, bringing different groups together so that they meet one another and they become friends because they have a common interest, whether it's grandchildren, a past career, volunteerism is huge. I mean, these are things that we have to think outside of the box and kind of foster those notions. So in closing, just thank you to the presenters. Thank you for everyone for joining us here this morning. I'm glad to see that the room at the end of this program still remains full. So oftentimes I get very nervous when people come because it tends to clear out as the day goes on. But maybe that's the beauty of having a morning appointment with good breakfast food. And so make sure you grab something on your way out. We hope to see you next year, and please don't be strangers. We are here to serve the community, and we know many of you are as well, so let's think of some ways that we can continue to do that.
One more thing before you go. Just, I second all of your thank yous, Natasha, but we also want to thank our incredible, our presenters, as you said, and an enormous shout out to the Cuyahoga County Board of Developmental Disabilities, United Way of Greater Cleveland, the Cleveland Foundation, and Western Reserve Area Agency on Aging for their unwavering support. And I just want to tell you, as my fourth year in a row and my second year in person, I am rewired. Yes, I am rewired. I am so impressed and to walk into a room and feel the love and compassion that you all have for other people. It is palpable on your faces and in the energy in this room, and it is truly my honor to be here because I keep saying I'm moving back to Cleveland and I'm taking advantage of everything you're offering. But thank you, fill your pockets. God bless you, have a great day, and hopefully I'll see you next year. Right, Tanisha? Just kidding, whatever.